Leg cramps are painful, sudden, and often completely unexpected. Millions of people across the United States, the United Kingdom, Canada, and Australia suffer from this agonizing condition every single night. Whether it's waking up in the middle of the night with a sharp, stabbing pain in your calf, or suddenly being forced to stop in the middle of a walk or workout because of a muscle locking up, leg cramps are not just frustrating, they're disabling. Especially for older adults, athletes, or people on certain medications, this issue can severely interfere with daily life and sleep. In many cases, the underlying problem isn't just about overexertion or poor circulation. It's about missing essential nutrients, especially vitamins that help nerves and muscles function properly. You might be drinking enough water, stretching, and even wearing the right shoes, but if you're deficient in these specific vitamins, the cramps will keep coming back. The number one vitamin that plays a massive role in muscle relaxation and cramp prevention is vitamin B1, also known as thiamine. This is critical for nerve signal transmission and muscular coordination. Without enough thiamine, your muscles receive weak or erratic nerve signals. Many people in the United States, especially older adults and those taking diuretics, are thiamine deficient, without even knowing it. Diuretics, often prescribed for blood pressure or heart failure, flush thiamine from the body, increasing the risk of cramps. Even people with diabetes, especially type 2, can suffer from low thiamine levels due to increased urinary excretion. When thiamine levels are too low, nerves misfire and muscles start to spasm or cramp unpredictably. You could be eating relatively well and still suffer from a deficiency, especially if you rely heavily on processed foods, alcohol, or have gut absorption issues. Another powerful nutrient often overlooked is vitamin B12. Vitamin B12 is essential for proper nerve conduction and muscle signaling. In fact, many patients in the United Kingdom and Canada who report chronic leg pain or tingling in the legs often turn out to be B12 deficient. This is especially common in people over 60, vegetarians, vegans, and those with digestive disorders, like celiac or Crohn's disease. A deficiency in B12 doesn't just cause cramps, it can also cause burning sensations, numbness, and balance issues. If you're experiencing nighttime leg cramps along with fatigue or brain fog, there's a high chance that a B12 deficiency could be behind it. In the United States, more and more doctors are starting to test for B12 levels when patients report unexplained nerve pain or cramping, especially in cases where iron or potassium seem normal. B12 supplementation can take time to work, but when the levels are corrected, many people report complete relief from cramps in less than a month. Vitamin D is another critical player. People in both northern parts of the United States and the United Kingdom often suffer from low vitamin D due to lack of sun exposure, especially during the long winter months. Without adequate vitamin D, calcium metabolism in the muscles becomes disrupted, leading to painful spasms and cramping. In fact, studies have shown that individuals with chronic leg cramps often present with vitamin D deficiency even when calcium levels appear normal in blood tests. What's shocking is how many people in Canada and the northern United States are walking around with dangerously low levels of vitamin D without ever being told by their doctor. If your muscles feel weak, tight, or like they're trembling under low exertion, it could be due to insufficient vitamin D. This vitamin is also crucial for the absorption of magnesium and calcium, which both influence muscle contractions. Without enough D, even a calcium-rich diet won't help. Then comes vitamin E, a powerful antioxidant that plays an underrated role in muscle recovery and cramp prevention. Vitamin E improves circulation and helps carry oxygen to the muscles, reducing the risk of sudden, sharp contractions during sleep or exercise. Athletes in Australia and high-performance sports communities across the United States have been using vitamin E supplements to support muscle function for years, especially in endurance sports where repetitive motion leads to oxidative stress. Poor blood flow is one of the most overlooked causes of cramps, and vitamin E helps address that by strengthening capillary walls and improving red blood cell flexibility. For people with conditions like peripheral artery disease or even early signs of varicose veins, vitamin E can be crucial. Some studies suggest that older adults who supplement with natural vitamin E experience fewer nighttime cramps and improved lower leg circulation. Vitamin B6 is deeply involved in how the body uses amino acids and creates neurotransmitters. If vitamin B6 is low, nerve signals can become distorted, leading to twitching, spasms, or sudden muscle locks. People with carpal tunnel syndrome, restless legs, or chronic muscle tightness are often low in B6 without knowing it. It's especially relevant for people in the United States who are taking medications like isoniazid, hydralazine, or birth control pills, which deplete B6 levels. Even chronic stress can lower B6, leaving nerves more irritable and muscles more prone to sudden cramps. Without B6, your body also struggles to utilize magnesium, which is another essential cramp-fighting mineral. People who wake up in the middle of the night with calf cramps or arch pain in the feet might not realize the trigger is a vitamin B6 deficiency silently building up over time due to lifestyle, medications, or poor diet choices. Vitamin C, while not directly involved in muscle contraction, supports the health of connective tissue, blood vessels, and the repair of micro tears in muscle fibers. This is important because chronic cramping often leads to local inflammation, which slows recovery and increases pain sensitivity. Without enough vitamin C, muscles are more prone to soreness, delayed healing, and re-injury. People in the United States and Canada who consume high-sugar diets or smoke tobacco are at greater risk of vitamin C depletion. Even emotional stress can burn through vitamin C stores, leaving muscles more vulnerable. Vitamin C is also critical for collagen synthesis, which maintains muscle sheath and tendon health. If you find that cramps are followed by lingering soreness, or they're triggered by minor overuse, low vitamin C could be part of the equation. Another underestimated nutrient is vitamin A, which is involved in cellular growth and repair, including muscle tissue regeneration. It works in synergy with vitamin D and helps maintain the integrity of muscle membranes. Without enough vitamin A, muscle fibers can't repair properly after microdamage, leading to increased susceptibility to cramping and stiffness. This is particularly relevant in aging populations in the United States who may not get enough fat-soluble vitamins due to low-fat diets or poor absorption. People with gallbladder issues, liver dysfunction, or pancreatic disorders also frequently lack vitamin A and may not even know it until secondary symptoms like dry eyes or skin issues appear. But long before that, muscles may already be showing signs through frequent cramps and poor recovery after physical activity. Folate, or vitamin B9, is crucial for red blood cell production and oxygen delivery to muscle tissue. In both the United Kingdom and the United States, folate deficiency is still shockingly common, especially among people with poor dietary intake of leafy greens, those consuming a lot of alcohol, and individuals on certain medications like methotrexate or anti-seizure drugs. Folate deficiency can lead to fatigue, shortness of breath, and poor circulation, all of which increase the risk of muscle cramps. What's worse is that low folate often goes unnoticed for years, only surfacing through symptoms like leg pain, weakness, or irritability before any blood test picks it up. Folate is also essential for methylation, a process critical for detoxification and muscle cell regeneration. Without it, the risk of inflammation increases dramatically, contributing to chronic cramping. The ninth and final critical vitamin to prevent leg cramps is vitamin K2. While vitamin K1 helps with blood clotting, K2 specifically helps direct calcium into the bones and away from the soft tissues like arteries and muscles. When calcium ends up in the wrong places, especially the muscle cells, it causes calcification that leads to stiffness and spasms. In the United States, calcium supplements are widely used, but most people are never told about the importance of balancing them with vitamin K2. Without it, calcium can build up in muscles and blood vessels, leading to dysfunction. This issue is particularly dangerous for older adults who are supplementing calcium for osteoporosis, but don't realize they're also increasing their risk of cramps, hardening of the arteries, and muscle stiffness. Studies show that people with higher K2 levels have better vascular function and lower risk of cramping, even when taking high levels of calcium and vitamin D. Many people suffer silently from leg cramps, believing it's just part of aging or bad luck, when in reality it's often a very preventable condition tied to vitamin imbalances. In the United States, nutrient deficiencies are more common than most realize, even among those who consider themselves healthy. The standard American diet, filled with refined carbs, added sugars, and processed ingredients, strips the body of critical micronutrients while offering little in return. Medications, alcohol, caffeine, and even chronic stress further deplete the reserves of these essential vitamins. Across the United Kingdom, Canada, and Australia, similar patterns emerge, especially with modern lifestyles that prioritize convenience over nutrient density. People are left chasing short-term fixes like painkillers or stretching routines, while ignoring the root cause that could be sitting silently in their bloodstream. Many doctors still don't connect leg cramps with vitamin levels unless asked specifically, leaving patients frustrated and stuck in a cycle of pain and confusion. You have to ask, how many people out there are suffering needlessly, night after night, simply because they don't know which vitamins they're missing? The frustration of dealing with nightly leg cramps or sudden spasms during the day can take a massive emotional toll, especially when no one seems to offer clear answers. People in the United States often go through multiple visits to primary care doctors, even neurologists or cardiologists, only to be told it's probably dehydration or aging. And while hydration is important, it's only part of the equation. You need specific vitamins for your muscles and nerves to communicate properly. The United States healthcare system is notorious for being reactive instead of preventive, which means unless you push for lab tests or demand nutritional evaluations, deficiencies can go undiagnosed for years. Even in countries like Canada and Australia, where healthcare is more accessible, many patients still fall through the cracks when it comes to subtle but deeply impactful issues like micronutrient deficiencies causing chronic leg cramps. Vitamin deficiencies don't just happen overnight. They build up slowly, day by day, especially when your diet, medications, stress levels, or lifestyle choices interfere with how nutrients are absorbed or stored. For example, someone eating fast food 5 days a week, skipping vegetables, drinking coffee multiple times daily, and dealing with high stress at work may not realize that their body is gradually running on empty. Their muscles are becoming more sensitive, nerve endings are firing unevenly, and blood flow is decreasing, all setting the perfect trap for those agonizing cramps to hit. Even people in the United Kingdom and Australia, who might assume they're getting enough vitamins from a varied diet, often forget that farming practices have changed, and many foods are lower in nutrients than they were just a few decades ago. One powerful reason these 9 vitamins make such a difference is because they all influence muscle activity at a cellular level. Take vitamin B1 again. This vitamin is needed to turn glucose into energy. Without it, the muscle cells literally starve, even if you're eating enough carbs. You may have a full stomach, but your muscles feel weak, tight, and unstable. People in the United States with prediabetes or full-blown type 2 diabetes are especially vulnerable here. That's millions of people right now walking around with early nerve damage, called peripheral neuropathy, and no clue that part of it could be fixed with something as simple as B1 supplementation. It's not just about taking a random multivitamin, either. Most over-the-counter formulas in the United States don't even include the active form of B1, which is benfotiamine. This is the form your body actually absorbs and uses, especially if you already have insulin resistance or are on a high-carb diet. If your current vitamin isn't helping, it could be the wrong form altogether. Another example is vitamin B12, which is absorbed in the stomach through a complex process involving a protein called intrinsic factor. As people age, their stomach acid naturally decreases, and that protein becomes less effective. Combine that with acid blockers like omeprazole, which are prescribed constantly across the United States for heartburn, and you have the perfect storm for a B12 deficiency. A deficiency so deep that your muscles feel like they're buzzing. Your legs keep locking up at night, and no one tells you it might just be because your stomach isn't breaking down your supplements properly. Even many people on plant-based diets across Australia and the United Kingdom don't realize how fast B12 can drop without animal products. You might not notice it right away, but those cramps, that tingling, that weakness, it could all be pointing to the same deficiency. Vitamin D also deserves far more attention than it gets. It's been called a hormone more than a vitamin because of how many systems it regulates. When it's low, not only does your calcium regulation collapse, but your muscles literally lose the ability to relax properly. That's why people feel tight, achy, and locked up when they have low D levels. In the northern states of the U.S. and throughout Canada, especially in places like Michigan, Minnesota, Alberta, and British Columbia, vitamin D deficiency is so widespread it's practically the norm in winter. But even in sunny places like Florida, Texas, and Southern California, people wear sunscreen, stay indoors, and avoid the sun. Blood tests regularly show people with D levels as low as 15 ng/ml when optimal muscle function starts at 50 ng/ml and above. Low vitamin D doesn't just cause cramps, it causes muscle wasting over time, increasing the risk of injury, falls, and disability, especially in older adults. Then there's vitamin E, the antioxidant workhorse that's often forgotten unless someone is talking about skin health. But inside your body, vitamin E is stabilizing the red blood cells that carry oxygen to your muscles. Without oxygen, muscles switch to anaerobic metabolism and start producing lactic acid faster, triggering that familiar burning and tightness that often leads to a cramp. If you've ever felt like you're aging faster than you should, or that your legs can't keep up with the rest of your body, this might be one of the hidden culprits. When you dig deeper into B6, B9, and B12, the story gets even more intense. These three B vitamins are all involved in something called homocysteine metabolism. Homocysteine is a waste product in your blood that, when elevated, damages blood vessels, affects circulation, and causes inflammation. If your homocysteine is high, your muscles are less likely to get proper blood flow during sleep or activity, which increases the risk of cramps. High homocysteine has also been linked to poor heart health and cognitive decline. In the United States, folic acid is added to bread and cereals, but many people still don't convert it well, especially those with MTHFR gene mutations, which are surprisingly common. This means they may be taking in folate through food or supplements, but not activating it properly. They need methylfolate, the active form, to actually see results. Without the right form of B vitamins, your nerves stay inflamed, and your muscles suffer the consequences. Vitamin K2's role becomes even more important when you understand how calcium mismanagement affects muscle health. People are told to take calcium to prevent osteoporosis, but almost no one is told how to direct that calcium to the right place. Without K2, calcium doesn't go into your bones. It ends up in your arteries and soft tissues, including your muscles. This can make your legs feel hard, stiff, and prone to locking up. Many people in the United States are taking calcium and vitamin D, but are never told about K2, which works in synergy with both. Over time, this imbalance causes calcification, which leads to spasms and cramps that feel like they're coming from deep inside the muscle. You could be doing everything right, eating your dairy, taking your D, but still suffering from cramps because K2 isn't part of the equation. In every one of these vitamin cases, the same emotional thread keeps showing up. People are suffering in silence. They're blaming age, poor luck, or genetics, when in reality, the answer might be sitting on a supplement shelf or in a blood test their doctor never ordered. How many people in the United States are taking painkillers at night, stretching, endlessly, or cutting out physical activity altogether just to avoid another episode of leg cramps? How many older adults in the United Kingdom are waking up gasping in pain, rubbing their calves, thinking this is just what getting old feels like? How many Canadians have stopped hiking, walking, or exercising altogether because their legs cramp? So badly they're afraid to be far from home? How many Australians think their cramps are from poor posture or dehydration, when the root problem is a deep vitamin imbalance their healthcare system hasn't addressed?